Welcome to Part 2 of our presentation on the implications for medical practices of the Patient Protection and Affordable Care Act. In this installment of the series, we are going to review some of the major provisions of the ACA as they affect individuals, businesses, and payors. My name is Jim Hook, and I'm the Director of Consulting Services at the Fox Group. One of the most controversial provisions of the Affordable Care Act is the individual mandate. The individual mandate requires that every eligible person in the country have some kind of coverage for health care expenses. This could be traditional coverage obtained from an employer as part of employment. It could be coverage from a government program such as Medicare, Medicaid, the Veterans Administration, the Indian Health Service, or other similar government programs. It can also consist of coverage from insurance companies that meet the minimum standards set forth in the regulations implementing the Affordable Care Act. The minimum standards provision have been controversial, with requirements for benefits like maternity care, prescription drug coverage, and mental health care, which are sometimes not provided by employer plans. The cost of more comprehensive coverage may increase the cost for some individuals who must purchase private insurance. On the other hand, it means that these benefits are available when they are needed. Another controversial provision of the individual mandate are the assessments or penalties for not obtaining coverage. For individuals, these range from $95 or 1% of taxable income in 2014 up to $695 or 2.5% of taxable income in 2016. Assessments for families would be up to 3 times the assessment for individuals in each year. So the assessment or penalties start out fairly low, but increase substantially in a short period of time. On the other hand, these assessments are likely to be much less than the actual cost of coverage in each year. There are several categories of exemptions for persons subject to the individual mandate. These include persons with low income who cannot afford the coverage, persons with religious objections to purchasing healthcare coverage, Native Americans who may be obtaining coverage through tribal or Indian Health Services resources, and undocumented immigrants who do not obtain coverage through employment. The ACA also includes provisions for improved access to coverage, such as young adults remaining on their parents' plans until age 26, no denial of coverage to children with pre-existing conditions, no retroactive denial of coverage for errors on insurance applications, and a pre-existing condition insurance plan for those who have been uninsured for at least 6 months. These provisions can help in several ways. There's evidence of abuse of the rescission or retroactive denial process by insurance companies who find minor or inadvertent errors on insurance applications for those applying for private insurance. These errors aren't uncovered until a person has a claim for services, and insurance companies even incentivized some of their employees to look for and identify these types of errors so that coverage could be denied after claims are submitted. With the unemployment situation in the country for the last few years, there have been many people who have lost coverage through loss of a job and have even found their COBRA coverage has expired. The pre-existing condition insurance plan is designed to provide coverage to them prior to the operation of the health insurance exchanges. And there are more provisions of the ACA that can improve access to coverage. They include consumer assistance programs to help individuals identify insurance that is useful to them or their families, expanding Medicaid coverage using federal matching funds, health insurance exchanges to make affordable insurance available, continuing coverage by their own insurance plans for persons participating in clinical trials of new medications or procedures, and a waiting period not to exceed 90 days for people who are enrolling in employer health plans. There are also a long series of provisions designed to make coverage more affordable for patients. For seniors, these include rebates and discounts for their prescription coverage gap, the so-called donut hole, expanded coverage for early retirees, and subsidized employer coverage for retirees age 55 and older. Certain preventive care services are covered at no out-of-pocket cost. For individuals and families, provisions to make coverage more affordable include the 15% limitation on insurance plan administrative expenses, which has led to rebates to policyholders in 2012. Expansion of the Child Health Insurance Program, or CHIP, to make coverage more affordable for children, and tax credits for those purchasing insurance coverage through health insurance exchanges or other private sources. There are also a number of provisions in the Affordable Care Act designed to encourage businesses to provide coverage for their employees. These include tax credits for small businesses providing healthcare coverage for their employees. This credit is up to 35% of the employer contribution in 2010 and up to 50% of the employer contribution in 2014. In thinking about the provisions for businesses, it's useful to know how small and large businesses are defined and how many people work at each type. Small employers, those with 50 employees or less, are approximately 95%, or 5.7 million out of 6 million employers total in the U.S. But small employers employ a relatively small share of employees, covering approximately 25% of the workforce. Large employers, those with more than 50 employees, number approximately 300,000 in the country, or 5% of all employers. But the large employers employ approximately 91 million people, or 75% of all employees in the country. So when learning about the mandates for businesses to provide healthcare coverage for employees, it's useful to keep in mind those definitions of large and small employers. There is no requirement for businesses with less than 50 full-time employees to provide coverage. These employees will be able to purchase coverage in the health insurance exchanges and, depending on their income level, may receive subsidies to help pay for the coverage. Employers with fewer than 100 employees can also shop in the health insurance exchange market and obtain favorable rates for healthcare coverage for their employees. Employers with between 100 and 200 employees cannot use the health insurance exchange market, but do have a mandate to provide coverage. Employers with 50 or more full-time employees who do not offer health care coverage may have to pay penalties of between $2,000 and $3,000 per employee, depending on the level of coverage offered. And employers with more than 200 employees who offer coverage must automatically enroll their employees in their health plan. Employees can opt out later, but they must first be automatically enrolled. This chart, available online from the Kaiser Family Foundation, outlines the steps for determining if an employer is required to provide coverage and/or is subject to penalties for not providing coverage. Another controversial provision of the Affordable Care Act was the excise tax on so-called Cadillac plans. These are plans with extremely rich benefits typically offered to executives, but sometimes offered to union members by union plans. Congress voted to tax some of these benefits, in part to discourage plans which may encourage covered beneficiaries to overutilize services. Employer health plans must also cover essential services such as maternity care, prescription drug coverage, and mental health services. And there are annual fees on pharmaceutical manufacturers to help fund coverage for persons with low income. Finally, there are several provisions covering non-government payers, such as health insurance companies and health maintenance organizations. Health insurance companies will be subject to annual fees which will be used to subsidize the coverage for low-income individuals. These fees will increase from $8 billion in the aggregate in 2014 to $14.3 billion in the aggregate by 2018. Insurance companies and health plans must offer guaranteed issue and renewability of coverage to anyone who requests coverage, especially those requesting individual coverage through the health insurance exchanges. There will continue to be limits on administrative expenses of insurance companies and health plans, so that at least 85% of the premium dollars collected are spent on medical care versus administrative activities and profit. And health plans and insurance companies must also justify rate increases on their qualified plans offered to employers and individuals and health insurance exchanges. And the rate increases can be voided by the Secretary of Health and Human Services. Although insurance companies and health plans are not required to participate in health insurance exchanges, it's likely most of them will, since they represent a large source of new customers. But those companies participating must meet several requirements, including they must offer packages that meet the requirements to cover essential services such as maternity care, prescription drug coverage, and mental health services. They must meet certain marketing requirements to ensure persons signing up for their plans are not misled about the costs or benefits. They must maintain networks of providers, including physicians, hospitals, and other healthcare services, in order to provide the full range of services in their qualified plans. They must follow uniform enrollment practices to make sure persons enrolling understand their benefits, the provider networks, and other features of the plan. They must offer an enrollee bill of rights and ensure a list of these rights is given to persons when they enroll. And they must furnish reports on claims, enrollment, and other statistical data to the government from time to time. There are many excellent online references to find out more about the provisions of the Affordable Care Act, including the timelines, the individual and business mandates, and the requirements on payors. Here's a partial list. This has been part 2 of our presentation on the implications for medical practices of the Patient Protection and Affordable Care Act. In the next installment of the series, we're going to review some of the major provisions of the ACA as they directly affect medical practices. The Fox Group, providing excellence in consulting and implementation since 1989.